Okay, so current and emerging changes and challenges in the health system. Well, current ones, we've got our growing and aging population. So that increased population of people living 65 and over is going to increase the demand for aged care workers, increase the demand for training, increase the demand for facilities, and also specific training such as qualifying people for needs such as dementia and Alzheimer's. We also have an increasing amount of chronic conditions being managed in the country. So while less people are dying from things like cardiovascular disease, diabetes, etc., there are a significant number of people being diagnosed with these conditions, which requires ongoing, costly management for many, many years. And then these people will also eventually end up in aged care facilities needing that management, all right? None of this is sustainable, which is my fifth point down here. Something needs to be done to stop the amount of illness and disease that we have in Australia before the cost gets way out of hand. Other ones, we've got equity of access, so that's always going to be an issue, and it is still a current issue that we just haven't been able to manage yet. And the age-old question of preventative measures versus curative measures. And we know that only 2% is spent on preventative medicine. We would like to see that increase because long-term, that will reduce the amount of chronic conditions that people in Australia experience. But in the short term, it could lead people short of care, which could end up in drastic measures. So what about some emerging changes that are foreseen for the future? So the hospital at home service, which is really, really good, it is mainly used for things like IV treatments, physiotherapy, basically day procedures that are non-surgical, all right? This frees up beds in hospitals for people that need those surgical or other more serious conditions. So this is a good thing for our system, but it obviously requires workers to be able to be mobile and deliver these services in a home setting. The expanding privatisation sector in Australia is a double-edged sword. So it is good in the fact that it decreases the burden on the public health system. So there's less people having to wait in the hospital system and Medicare, etc., to get treatment, but it also increases barriers to access. And we already spoke that previously that barriers to access and equity of access is a problem. Finally, AI and data is probably the biggest thing going forward. It may decrease the human element behind diagnosis and treatment because of people's reluctance to embrace AI healthcare, and that human element actually may decrease service usage. So people are less likely to go get checkups if they know that their checkup is done by an AI bot, for example. And that's scary because then that will ongoingly increase the amount of disease and burden because people aren't getting diagnosed early, etc., etc. Okay. So they are current and emerging changes and challenges in the healthcare system in Australia, and that was your too long didn't study version.